JayDoc primarily is an acute care clinic, so we provide walk-in services on Mondays and Wednesdays for patients in the, mainly the Wyandotte and Johnson County communities who need any sort of these acute care services. So whether it be, a cold or a strep throat or a rash that's popped up, so things like that. That was kind of the primary intent behind JayDoc's creation.
JayDoc provides a means for patients that have no access due to uninsured status, or even if just underinsured status, a place to go to get in to see someone who's medically trained, who's going to be a doctor, or a pharmacist, or a nurse to help their medical conditions. And so it does provide an access point. And we refer them to medical homes from here so that we make sure that they get the health care that they need in continuity, because JayDoc is that stopgap for them.
Volunteering at JayDoc enhances my medical education pretty tremendously because it gives me a clinical tie to the material that we're learning in the first few years, whereas all of our patients during our first 2 years are multiple choice STEM questions with these perfect clinical presentations. These are real patients that you see, and that really helps those diseases and those principles stick. When you actually see something in the clinic, you really remember it.
When I was in medical school, we did not start seeing live patients until our 3rd year. And just a few weeks ago, we had some first-year medical students that had been medical students 3 days, and they were already down here in JayDoc Clinic.
JayDoc, I don't think JayDoc, I wouldn't say it enhances, I think it's part of my medical education. I think that on top of all the studies and things we do, it's great to take what we learn in class and in lectures and apply it to real world situations and on real patients.
Here, you really are tasked with being the advocate for that patient. You have to catch any symptoms that they have. I really feel like it gives me good exposure to patients that I wouldn't otherwise have.
And so it's a way to say, oh, I just saw that in my class and this makes sense to me now, why I'm learning that. So it helps put all the medicine together. And I think that no matter what they go into, their experiences at JayDoc will mean something to them because of that.
We work with dietitians, we work with physical therapists, we work with pharmacists, and all of them very enthusiastic about what they do here, so I've learned a lot from them.
We have interpreter services, dietetics. We've started integrating some mental health services. We always have pharmacy students and pharmacists here, so on any given night there are a lot of different professionals who are at JayDoc providing their respective services for the patient.
You get a little bit of insight into how our medical system functions and maybe in some ways how it dysfunctions when you hear people's stories on their lack of access to care. And people don't have health insurance for a variety of reasons, but this is a place that those people can come regardless of their background, regardless of the circumstances that brought them to where they are now. Doesn't ask any of those questions and just says, what's your problem and how can we treat it?
Being a second-year medical student, a lot of times we're studying all the time and attending lectures, and I think it's very easy to forget why we're here and why we want to be physicians. So volunteering at JayDoc kind of gives me a chance to, do what we actually came here to do, and that's to see patients and interact with them and try to make an impact in their lives.
It's just really rewarding to know that there's such a great need and to know that we as students are able to do something to help that need and to improve our communities.
I really find it exciting. It renews my passion for medicine. It reminds me why I went into medicine, because I can talk to the students and see the excitement in their eyes as they learn new things and get to meet the patients and help them. And it's really important for me to provide good care to people who can't access it, and this is one of the ways we can do that in Wyandotte County.
It's really nice to put a face and a history behind what we learn in class. And I think I've learned a lot of lessons here that I'll carry with me as I'm a resident and throughout my career.
The primary motivator for getting involved at JayDoc is that element of clinical practice. But I think after a couple times being at JayDoc, it's something that really pulls you in. I think the benefit of seeing acute needs is that a patient comes in with a problem and you can solve that problem for the patient, and they leave clinic and they are in a much better state of mind. You know, I've had patients who come in near tears, and by the time they leave, you know, they're smiling because you have done something to help them. And I think that's the most rewarding part for me, is seeing that these are individuals, you know, the JayDoc population, who otherwise wouldn't have medical care. If they rely on my knowledge and if I'm doing something to help them, that just draws me back more and more, knowing that I'm able to contribute in that way.